Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I've been having a really rough time lately. The pain in my toes, especially the big ones, just won't let up. It feels like they're stiff and cold all the time, and the tramadol doesn't seem to be helping as much as it used to.
I understand that must be quite frustrating for you. How long has this been going on with your toes?
It's been a few months now. At first, I thought it was just temporary, but it's just gotten worse over time. The cold sensation bothers me a lot, especially at night.
And how about your back pain? You mentioned it's been persistent. Can you describe that for me?
Yeah, the back pain is another major issue. It's this constant ache in my lower back, and it seems to be getting worse. I really think we need to look into it more, maybe get some scans done to see what's going on there.
Certainly, imaging studies like an X-ray or an MRI might help us understand the cause of your back pain better. Now let's talk about your blood pressure. How have you been managing with your medications?
To be honest, I've been struggling with the blood pressure meds. They make me feel a bit off, and I sometimes forget to take them. I know you've mentioned how important they are, especially with my blood pressure being as high as it is.
Yes, managing your blood pressure is crucial, especially to avoid further complications like kidney issues. Speaking of which, how have you been managing your diabetes?
The diabetes is another thing. The finger sticks are a real hassle. My blood sugar levels keep bouncing around, and taking glipizide hasn't made it any easier.
I see. It sounds like we need to address multiple areas to improve your overall health. How have things been on the personal front? I remember you mentioning some marital issues last time.
That's still a mess, honestly. Things aren't getting any better at home, and I'm seriously thinking about moving out. Plus, I've been talking to an old girlfriend, which complicates things even more.
It sounds like you're dealing with a lot of stress, which can definitely impact your health. Let's make sure we also keep an eye on your emotional well-being. Now, about the recent incident with your car, how has that affected you?
It just added to the stress, doctor. Losing the antifreeze and heat in the middle of everything else going on was the last thing I needed.
Understood. Let's summarize and plan accordingly. Your current blood pressure is 1 in 60/90 mmHg, which is quite high. We need to ensure better management there. Your blood sugar levels are also fluctuating, with a hemoglobin A1C of 7.8%, indicating that your diabetes control isn't optimal. Regarding your toe and back pain, based on the X-rays, there are signs of osteoarthritis which might be contributing to the discomfort. Given your elevated serum creatinine level of 1.7 mg/gallon, I strongly recommend a consultation with a nephrologist to evaluate your kidney function further.
That sounds like a lot, but I understand it's necessary. What's the next step then?
Here's the plan. I will adjust your medications for blood pressure and pain management, and will schedule regular follow-ups to monitor your blood pressure closely. I'll also arrange for the imaging studies for your back, as well as the ultrasound for your kidneys. It's crucial that you try to adhere to your medication schedule more strictly to prevent your conditions from worsening. We'll also need to keep an eye on your cholesterol and triglyceride levels, which are quite high, potentially increasing your risk of other complications. Your next appointment will be in a month, but if you have any concerns before then, please don't hesitate to contact us, and please start monitoring your blood pressure at home if possible.
Thanks, doctor. I appreciate you helping me figure all this out. I'll try to keep everything on track this time.
You're welcome. Remember, managing these conditions is a team effort, and I'm here to support you through this. See you in a month, or sooner if needed.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I've been dealing with quite a bit of pain, both in my back and my knee. The back pain is mostly in the lumbar area. It's been an ongoing issue since my military service. I've had bulging discs noted in the past, and sometimes the pain gets so bad I end up at urgent care. I've tried Flexeril and physical therapy before, but now I mostly use Tylenol or Aleve when it's unbearable. It really affects my work and my ability to play with my kids.
I understand that must be really challenging for you. Tell me more about how these issues affect your daily activities.
Well, it's tough. I can't sit for long because of my knee, and standing too long isn't any better. My job requires a lot of physical activity, which just makes everything worse. I had knee surgery back in 2000, but the pain never really went away completely. It's like I'm always adjusting my day to manage the pain.
That sounds very difficult. What about your migraines?
They're just debilitating. I take Imitrex, which helps prevent them to some extent, but when I get a migraine, I'm pretty much out for the count. I have to work from home because I can't function normally. The lights, the sounds, everything becomes too much.
It sounds like the migraines significantly impact your life. Have you noticed anything that triggers them?
Stress seems to be a big trigger, and maybe the back pain contributes too. It's all interconnected. With 2 young kids at home, it gets pretty stressful.
And how have you been sleeping?
Not great, actually. I used to take Trazodone because the Flexeril made it hard to sleep. It's like I can never fully rest, which just adds to my exhaustion during the day.
Sleep is crucial, especially with everything else you're managing. Have you been able to find any relief for your emotional and mental health?
That's another uphill battle. I have PTSD and bipolar disorder from my time in the service. I tried group counseling, but it wasn't very helpful. Everyone's experiences were so different. I think I would benefit more from individual counseling.
It's important to have support tailored to your needs, especially with such a complex history. Let's also talk about your overall support system. How is that looking?
It's mostly just me. I'm the primary breadwinner, and I feel a lot of pressure to provide despite the pain. There are days when I face discrimination, or I feel like I'm not fully understood, especially when I seek care for my pain.
It sounds like you're carrying a heavy burden. Let's see how we can address these concerns comprehensively. First, we'll start with updating your imaging studies for both your spine and knee to assess any progression. Physical therapy could be beneficial, arranged around your work schedule.
That would be helpful. I just want some relief that lets me live a little more normally, you know?
Absolutely. We'll explore new options for migraine prevention and your pain management. Additionally, a referral to neurology for your migraines and to orthopedics for your knee pain will be crucial. I also recommend setting up an appointment for a psychiatric evaluation to better manage your pain bipolar disorder. We should also consider a consultation with a social worker who can help you connect with services and benefits.
I appreciate that, doctor. It feels good to have a plan.
I'm glad to hear that. Let's make sure we follow up on all these aspects. Your health and well-being are our priority, and we're here to support you through this. We'll get all the necessary appointments scheduled and start on some interventions that can hopefully improve your quality of life.
Thank you, doctor. It means a lot to know there are steps we can take.
You're welcome. We'll do everything we can to help you manage these challenges. Let's schedule a follow-up in 6 weeks to evaluate how the treatments are working and make any needed adjustments. In the meantime, my team and I are available if you need any immediate assistance.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
So, this is the remote monitoring device we're going to use to keep track of your weight. Have you used anything like this before?
No, this is all new to me.
No worries, I'll walk you through it. First, you'll need to stand on the scale every morning before breakfast. The device automatically sends your weight data to us via Wi-Fi.
Do I need to turn it on each time?
No, it activates as soon as you step on. Just make sure it's connected to your home Wi-Fi. Here's how to connect it.
What if there's an error or it doesn't connect?
If there's any issue, just call our support team. We're here to help make sure everything runs smoothly and your health is monitored accurately.
Now look at question 26.
I see you have both chronic kidney disease and diabetes, so it's crucial we manage your medications carefully. Are you currently on any new prescriptions?
Yes, I was prescribed metformin and lisinopril recently.
Good choices. Metformin is excellent for diabetes, but we need to monitor your kidney function regularly, as it can be affected by your condition. Lisinopril helps protect your kidneys, but can also affect your potassium levels.
Should I be watching for any specific side effects?
Yes, watch for any unusual swelling, sudden weight gain, or if you feel unusually tired. These could be signs that your medications need adjusting.
Now look at question 27.
Today I'll be discussing the legal rights of individuals with mental illness in the workplace. It's crucial to understand that mental health conditions are covered under the Disabilities Act.
What protections does the Disabilities Act provide?
The Disabilities Act requires employers to provide reasonable accommodations unless doing so would cause significant difficulty or expense. This can include flexible work hours, job restructuring, or even teleworking options.
How should one request these accommodations?
You should request accommodations formally in writing and provide documentation from your healthcare provider. It's important for employees to communicate their needs clearly to find a suitable arrangement.
Now look at question 28.
Let's address the recent cyber attack and discuss how we can maintain safety and care continuity. First, ensure all patient data accessed during the outage is securely logged.
Absolutely, and we need to manually document everything until systems are back. How are we ensuring that all team members are aware of the fallback procedures?
We've initiated emergency protocols and training sessions for all staff. It's crucial everyone understands their role in these situations.
We should also have a system to quickly communicate any updates or changes in patient condition to the whole team, maybe through handheld radios.
Great idea. Let's implement that immediately.
Now look at question 29.
Managing chronic pain effectively requires a comprehensive approach. What strategies have you found most effective in your practice?
I've seen good results with a combination of physical therapy and cognitive behavioral therapy. It's about more than just managing pain. It's teaching patients how to cope with it.
Absolutely, and we shouldn't overlook the role of medications. Opioids may be necessary for some, but we must be cautious about dependency.
Agreed. What about alternative treatments, things like acupuncture and biofeedback?
Those have shown promise in many cases. It's all about personalizing our approach to fit each patient's needs and preferences.
Now look at question 30.
With the rising interest in traveling abroad for cosmetic procedures, we need to consider the risks involved. What are the main concerns from a medical perspective?
The lack of follow-up care is a big issue. Patients often return with complications that are costly and difficult to manage.
Yes, and there's also the question of quality. Not all countries have stringent medical standards or regulatory oversight.
We should develop guidelines for patients considering such procedures abroad. They need to be fully informed about the potential risks and the importance of vetting the facilities and doctors.
Exactly. Educating our patients will help them make safer choices and reduce complications.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Today, I would like to delve deeply into the complexities of bicuspid aortic valve, BAV, disease, a congenital condition characterized by the presence of 2 leaflets instead of 3 in the aortic valve. This disorder is not only the most common congenital heart defect, affecting approximately 1 to 2% of the general population, but also presents a significant challenge due to its varied clinical manifestations and outcomes. The pathophysiology of BAV is intriguing due to its genetic underpinnings and the resultant morphological and functional impacts on the heart and aorta. Genetic studies suggest that BAV is primarily an autosomal dominant trait with incomplete penetrance and variable expressivity, leading to a wide spectrum of phenotypic presentations. This genetic variability is crucial for understanding the clinical heterogeneity seen in patients, from asymptomatic individuals to those with severe complications like aortic stenosis or aortic dissection. Advanced imaging techniques have significantly enhanced our understanding of BAV. Echocardiography remains the cornerstone for initial diagnosis and assessment, providing detailed images of valve morphology and function, as well as initial measurements of aortic dimensions. However, the role of cardiac MRI and CT angiography has become increasingly important. These modalities offer superior characterization of the aortopathy frequently associated with BAV, allowing for precise measurements of the aortic root and ascending aorta and better visualization of the extent of aortic involvement. The management of BAV is highly individualized, guided by the specific valve morphology,
the severity of valve dysfunction, and the extent of aortopathy. The latest guidelines recommend a comprehensive approach that includes regular monitoring of valvular function and aortic size, medical management of associated cardiovascular risk factors, and timely surgical intervention when indicated. Now, let me illustrate these points with a case study. We recently managed a 34-year-old male patient diagnosed with a BAV and moderate aortic stenosis. His initial echocardiogram showed a typical right-left cusp fusion with mild aortic root dilation. Given his young age and the progressive nature of his valve disease, we conducted a cardiac MRI which revealed an ascending aortic aneurysm measuring 4.5 centimeters, a critical finding that altered our management approach. Considering his risk of aortic dissection, we opted for early surgical intervention. The patient underwent a successful valve-sparing aortic root replacement, which is preferred in younger patients to preserve the native valve and avoid lifelong anticoagulation. Post-operatively, his recovery was uneventful. He now remains under regular surveillance to monitor his aortic dimensions and valve function. This case underscores the importance of a tailored approach to BAV management, incorporating genetic insights and advanced imaging to guide decision-making. It also highlights the necessity for lifelong surveillance given the progressive nature of the disease. The management of BAV requires a multidisciplinary approach involving cardiologists, geneticists, and cardiac surgeons. Ongoing research and clinical trials will hopefully provide further insights into the genetic mechanisms and optimal management strategies for this complex condition, improving outcomes for patients across the spectrum of the disease.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Good afternoon, everyone, and thank you for joining today's seminar on the advances in gene therapy and its application in treating rare genetic disorders. Today, I will focus on our latest research concerning hematopoietic stem cell transplantation, HSCT, and genome editing for lysosomal storage disorders, LSDs, specifically addressing the challenges and breakthroughs in treating these complex diseases. Lysosomal storage disorders are a group of over 50 genetically inherited conditions characterized by an enzyme deficiency that leads to an accumulation of toxic materials in the body's cells. These disorders can affect various parts of the body, including the brain, peripheral nervous system, liver, and skeletal system, leading to a range of serious health issues. One of the primary treatments for certain LSDs has been HSCT, which involves transplanting blood-forming stem cells to potentially correct the enzyme deficiencies. However, traditional HSCT relies on donor-derived cells, which can lead to complications such as graft versus host disease and immune rejection. Moreover, the difficulty in crossing the blood-brain barrier poses significant limitations for treating neurologically involved LSDs. Our research has pivoted towards utilizing gene editing technologies, such as CRISPR-Cas9, to enhance the effectiveness of HSCT. We specifically use a technique known as autologous transplantation, where the patient's own cells are edited to correct the genetic defect and then reintroduced into the body. This method significantly reduces the risk of immune rejection and avoids the complications associated with donor cells. In our latest study, we have focused on a specific lysosomal disorder called mucopolysaccharidosis type 1, MPS-IN, which is characterized by a deficiency in the enzyme alpha-L-iduronidase. This deficiency leads to the accumulation of glycosaminoglycans, causing various symptoms ranging from skeletal deformities to cognitive impairment. We applied CRISPR-Cas9 technology to edit the hematopoietic stem cells of patients with MPS-IN. Our approach targeted a safe harbor site within the genome, ensuring stable and long-term expression of the corrected gene without disrupting other critical genetic functions. These edited cells were then transplanted back into the patients in a controlled clinical trial. The results from our preliminary clinical trials have been promising. Patients showed improved enzyme levels and a reduction in the accumulation of glycosaminoglycans. Importantly, the edited cells successfully engrafted and began producing the functional enzyme necessary to alleviate the disease symptoms. To illustrate the impact of this therapy, let me share a case study of a patient from our trial. Let's call him John. John was diagnosed with MPS-IN at an early age and experienced severe developmental delays and skeletal abnormalities. Before participating in our trial, John had undergone multiple surgical procedures and was frequently hospitalized due to complications related to his condition. After undergoing the autologous HSCT with his genome-edited cells, John showed remarkable improvement. His enzyme levels normalized, and his physical symptoms stabilized. For the first time in years, John experienced a significant reduction in pain and increased mobility. His quality of life improved dramatically, highlighting the potential of this innovative treatment. This research paves the way for further studies and highlights the necessity of integrating advanced genetic editing tools with traditional stem cell therapies. Our future directions include optimizing the gene editing tools for greater efficiency and safety, and extending this approach to other lysosomal storage disorders. The combination of HSCT with genome editing represents a transformative leap forward in treating rare genetic disorders. It offers hope to patients like John, who previously had limited treatment options. Our work continues to evolve, driven by the goal to turn incurable diseases into treatable conditions. Thank you for your attention. I am now open to any questions you may have about our research and future directions in this promising field.